Hi everybody, this is Tony Viazzi, the founder of Fastbraces and the inventor of our technologies. We're coming to you today from the Fastbraces.com campus in Dallas, Texas, where we interview successful dentists from around the world that apply Fastbraces technology to their patients. We're very, very happy to have with us today the very first dentist from the country of Cyprus, of the European Union, Dr. Andreas Aspros. Andreas, welcome to the show.
Thank you so much. It's my honor meeting you here at Dr. Viazzi's. The campus, you created an amazing campus here.
Sure, thank you. Well, you know, this has been a lifelong effort. I was very, very happy when my brother told me about you. My brother, Angelo, he said that you wanted to do orthodontics, and you know, I think you went to, did you go to Washington, D.C. for your first seminar?
I went back in 2017, I went to Washington, D.C.
Wow.
And I had the Fastbraces lecture there.
The original seminar.
The
original training of yours.
Yes.
And now you're a senior master provider,
now
right?
I'm a senior master provider.
Remember, we actually went and gave that big seminar in Cyprus when we introduced this in your country.
Yes.
And we had over 100 people attend. That was pretty amazing.
It was one of the biggest seminars, dental seminars ever held in Cyprus.
Wow.
Yes, it was about November 2017.
Yeah, yeah.
I have been there. I was I was practicing Fastbraces only 1 month. And I had the chance to meet all the people, the Dr. Angelo, Dr. Tom Pagonis.
Yeah.
And yes,
no, that was a great seminar. That was
a great boost for my clinical practice.
Absolutely. Tell us about your office. Where is it located? Or I think you have more than one location.
I have, I'm in 5 locations.
5 locations?
Yes, I have my original office is in Paphos.
Uh-huh.
I have an office in Nicosia, the capital of Cyprus.
Okay.
Recently, I have opened an office in Polis Chrysouchous, a small town where it's very nice to go there for holidays in summer.
Okay.
And I'm an associate dentist in 2 dental clinics in Limassol, one in Limassol and one in Paralimni.
Wow. And how, what's the population of Cyprus?
The population of Cyprus is about 1 million,
1 million
people. Yes.
So with the 5 locations you have, you should be able to reach different parts of the whole country and get patients from all over the island.
Yes, this was the idea, to be very close to a lot of people.
Yes.
And I think slowly we are there.
You're getting there. That's remarkable. That's wonderful. And you're also, Andreas, you're also a provider that helps us with technical support. You offer technical support to other doctors in Cyprus and in Greece that apply Fastbraces technologies, along with my brother, Angelo. You guys both help other dentists in the Greek language, which not very many people speak.
Okay, yes, an old saying says that if you want to learn science, a technique better, you have to teach it. So
you have to teach it.
I'm very enthusiastic doing this. I love doing this. Apart from improving my knowledge, I have the chance to meet people, speak with people, and this is something very good because science brings a lot of colleagues together.
Absolutely, absolutely. Tell us about your future plans. How do you see your practice growing, your offices? Because I understand you've been on television in Cyprus. You've been on various shows on Cyprus television.
Yes, I'm in various shows in Cyprus. People in Cyprus want to know about the new techniques, especially this Fastbraces technique, which is something that intrigates them, because they say that we can straighten teeth in 120 days.
Sure.
And this is one of the most important aspects in orthodontics.
Sure.
And one of the main, the time is one of the main reasons that the long time, especially with the traditional orthodontics, was one of the reasons that keeps a lot of people away from the orthodontics. But now with Fastbraces, we can provide a treatment in short time, safe for the patients, and with successful results.
Yeah, the technology, a lot of our doctors say, they can straighten teeth really fast, right? Even in about 100 days.
Yes.
Which is remarkable. If you think of the old ways where you would say treatments would take 2 to 3 years, who would have thought that something could even take even under a year? And now, even 100, 120 days is possible. I'm very proud of that. I think we've come a long way. Tell us about your family. I understand you have four children.
I have four children.
You have 4 children. What are their ages? What are their...
My first son, my eldest son, is 17 years old. And the rest of the children are triplets. They are 2 boys and a girl. They are 11 years old.
That keeps you busy.
Yeah, yes, I'm more 24 hours busy.
So 5 locations you go to and 4 kids at home. You must be Superman.
Yes, but
super dentist.
When you love something, when you love something, it's like your hobby. You don't complain. You don't get these negative feelings and say that I'm getting tired. No, I like this what I'm doing, so I do it with all my pleasure and all my joy. So I like it.
And you're quite the athlete. You said you ran half a marathon the other day.
Yes, the last 2 years, especially when the first lockdown in the COVID era occurred, I decided that I had much time, so how could I benefit from this extra time? So I decided to improve my nutrition, and I start running, going to the gym. So now I have improved, and yes, last week I've run 20 kilometers, a half marathon.
Wow. What else would you like to share with us? Do you have any patient stories from your patients where they finished with Fastbraces and they saw the results?
I have a story that I will never forget, and I will always say about this. It was a very beautiful woman, 22 years old. He came to my office in Nicosia for a consultation, and he was crying because she was said that if she wanted to have a nice smile, she had to extract 2-3 teeth, make orthodontic surgery, and she was desperate.
So specialists had told her that she needed jaw surgery?
Yes, yes. Wow. And that made that girl very upset. So when I said to her that we could treat your problems in a matter of days, she couldn't believe it. She said to me, well, I'm going to go and think about it. A week later she told me, and she said to me, we will start. So we started. Of course, COVID occurred with the lockdowns. We had some delays, but in a matter of 200 days, we finished the treatment.
Wow.
The girl, when she saw the results, she was crying.
Wow.
She was crying in the office, and 2 years now, we speak, and she says me how much she loves the result, how much she's enthusiastic, and how much she proposed the therapy to her friends.
To her friends, in fact. Wow, that's wonderful. That's very moving.
It's amazing.
It's a life-changing.
It's a life-changing, yes.
Yeah. And do you have any advice, any thoughts you want to share with other dentists about what can they do for their offices?
Fastbraces is not only an aesthetic treatment as orthodontics used to consider. It's a therapy that everybody should do, especially people that have crooked teeth, because we all know that around crooked teeth there are some bacteria that they cannot be eliminated with a normal cleaning. So if we want to have a healthy environment in our mouth, we have to straighten that teeth to reduce the amount of that bacteria, make the proper cleaning and the oral hygiene instructions, and have a healthy mouth.
Yeah.
So we are not talking only about aesthetics, we are talking about function, of course, and biology.
Sure.
And so I think this is a parameter that every dentist should consider in their offices.
Absolutely, make it part of a hygiene.
Exactly.
Yeah, especially, you know, as you very well know, Fastbraces, we have the 2 patents, one on the alveolar bone restoration and the other one on the treatment of orthodontitis, or as we call the gingivitis around crooked teeth. And the bacteria around the crooked teeth, you know, they're gram-negative. They're quite a bit aggressive, like Treponema denticola, Fusobacterium nucleatum. And then, of course, more and more articles are coming out where they're finding these relations or associations with the major diseases like Alzheimer's, colorectal cancer, heart disease, and so forth. So no, I believe that in years to come, it will be a lot more serious to, well, let's put it this way. You'll go to the physician maybe, and one day they'll say, you know, watch your diet and exercise, and make sure you straighten your teeth.
Exactly.
Not just clean them, but straighten your teeth so you can properly clean them. Because if you don't straighten them, if you clean them, the bacteria go back there again, because you can't really clean them as well.
And of course, the dentist should understand, and especially the new dentist, that dentistry is not about making a filling, making a root treatment. It's about providing a healthy mouth environment.
Yes.
And if bacteria are in your mouth, it means that they are all in your body, everywhere in your body. So you have to start eliminate the bacteria, especially the bad bacteria, where they are in your mouth. So so as you can have a healthy body.
Wonderful, wonderful. Well, it's been wonderful chatting with you today. I'm glad you came. You came all the way from Cyprus to Dallas, and we're very, very glad to have you. We're going to have a great 2-day program the next couple of days.
Thank you so much. That was a dream, and dreams come true someday.
Wonderful, wonderful, wonderful.
Thank you so much.
Thank you. Well, everybody, if you like what you've heard today and you want to hear more successful stories from successful dentists around the world, follow us on Instagram, on YouTube, subscribe on all of our channels. Go to fastbraces.com and register for one of our free online seminars and become a Fastbraces provider. I'll see you soon.